I felt like I needed to prepare myself for other opportunities. I saw the profession growing and merging with the medical field. So I said, we probably eventually are going to be seeing some medical dental integration, and I want to be prepared for those doors that open.
We also communicate that we are not a dentist. We're a hygienist. We're here to educate and get you to the next level that's going to help you with these more complicated issues for your oral health. So we make it really clear that we're the liaison to the dental office as well. So we focus on other ways to provide resources for that family. So we look at the family unit to be very healthy, not just the individual child.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 215. Today on the show, we have Laurie Clark and Michelle Gross Panico talking to us about public health. And I am one of your hosts. My name is Andrew Johnston.
And I'm the better host, Michelle Strange. Welcome to this little dental podcast of ours. We're glad you're listening. If you are a veteran listener, thanks for coming back. If you're new to this, we are going to do our little rambling here in the beginning, and then we're going to get to our interview with Laurie and Michelle, which was all about public health. And it was really fantastic. So hello, Andrew.
I like how you say rambling. And then I think the plan for this particular episode is you're going to actually talk about how amazing the opportunity was at the OSAP boot camp.
Yeah, that's not a lot of ramble.
That's not ramble.
It's not. That's actually good content there.
You guys need to listen to this part because this is going to be one of the more important things that Michelle ever said in her whole entire life.
If you are new to the acronyms, I guess, of OSAP, you need to go to osap.org, OSAP.org. It is an amazing organization that's meant to create the safest dental visit. And they are just such a wealth of knowledge. They have a great newsletter. They have all kinds of resources. If you are worried about infection control, compliance, you're not sure if this is OSHA or CDC or EPA or FDA or NIOSH or ANSI, AIM, all that, they got it for you. And their membership is not a lot of money. And I'm pretty sure I get my money's worth when I send them 1 million questions every week where I'm like, hey, because there's a thing that's called Ask OSAP and you can send them your infection control questions and your compliance questions. It's so helpful. And then every week I get something called Info Bites. And so I was just at their conference. They have 2 conferences every year, boot camp, which is in January, and then their annual session, which is going to be in May 2020 in Minneapolis, which I've never been to. So I'm excited to go. And I was there. This is my second boot camp. Now, if you are any kind of a compliance nerd, then this is your jam. If you're not a compliance nerd and you're like, I'm stuck with infection control, I don't love it because I don't know all the words and the protocols and the safety stuff, then this is your meeting because they break it down so beautifully. It's 3 days. It's your brain hurts after a while, but they have little brain breaks. It was just so fantastic. And we're just big fans of everyone over at OSAP. Like, really, I am.
Yeah, for sure.
I was telling the story. Oh, when I got to meet India, who was on the podcast, India Chance. I got to meet her in person. I love her even more than I loved her before. And Laurie and Angel and Samantha. I'm so glad that I got to hang out with you guys. And it was so great. And then, of course, our favorite Michelle Lee, who also has a podcast over on Dental Podcast Network that's all for OSAP. And you should definitely check that out. But I was like a baby hygienist, like 4 years out, maybe. I'd say anything under 5, I was still kind of an embryo of a hygienist. Like I was just learning. And I remember going to Olivia Wan's OSHA course. Olivia was on the podcast too. She's fantastic. She was so entertaining and I learned so much that I remember the guy I was dating at the time. Now, granted, this was like 10 years ago, like if not more.
1.0, which
shut your
Ryan
face. Ugh, you're the worst. Anywho, One of the guys I was dating. Actually, is the guy I was engaged to. I mean, believe it or not, I did almost lock somebody down.
Someone almost locked you down, but then...
That's right. And then I was like, gotta go. So I remember on the way back from that meeting, which was like an hour and a half away from me, I was like, God, I would love to do this one day. I would love to be up there talking about this because it's so important. It matters so much. I know none of us went into this profession to make people sick, to make people, die from water, dirty water, or die from cross-contamination. I just posted something on our news feed that was all about a New Jersey dentist and somebody died from endocarditis. Like none of us went into this profession to do that. And so I just think it's so important. And I remember him saying, no one will like you if you do that. Don't do that. Everyone will hate you. And I remember that so much. And it has always stuck with me how much I love infection control. And now I'm like, I don't care if anybody likes me or not. This is for the greater good of patient care. So.
That doesn't surprise me. That sounds exactly like you. It's like, you know what? Screw the world. As long as I'm right about this, nothing else matters.
As long as I'm doing something good for someone else, that matters to me. If someone doesn't else like it because they're doing the wrong thing, I don't really care.
Can I interject a thing that doesn't really make any sense to this, but it kind of does. So I was watching this show and everyone's going to crucify me because I don't remember what the name of it is, but it's basically where they eat really hot chicken wings they eat spicy chicken. So it's an interview show. And they have all these celebrities on there. And so they had Dax Shepard was on there for, a couple of things. They had a bunch of comedians that are on there.
I love his.
A little while later, Kristen Bell, Dax's wife, was on there. And so I was on the plane last night and I was watching that and they kind of get a little bit philosophical. And I'm not going to lie. I had this little thing happen in my brain just now when you were talking, because Kristen was explaining a couple of different philosophical beliefs that they talk about in The Good Place, one of the shows that she's on. And it's, do you sacrifice the one for the greater good, or do you sacrifice all of the other ones to save the one? And where are you at in this philosophical belief system? And I'm like, you know what? Gosh, Michelle would just kill so many people no matter what. like they're neither the best or the worst. They're just gonna die. It's fine. I would love to know where you're at.
If you really aren't contributing anything good to society, you must go.
Just go. You're not here for the greater good.
It's a character flaw I'm working on, guys. I promise. I'm sorry, but if you are causing harm to anyone, I will personally come at you.
No, seriously. Yeah, that's your personality. It's fine.
That is my personality. Don't hurt people. Don't be mean to people. Don't bully. Don't do all that stuff. And I'll stay on your good side. Or you'll stay on my good side. Yeah. I guess.
Anyway, sorry.
Anywho, OSAP's amazing. OSAP is so fantastic. You should definitely check them out. And I'm really excited to dive even more into infection control. So anywho, that was what I was doing. And then you were at Yankee. We did talk about that, but you were at Yankee and it was a great time.
We had a great time at Voice of Dentistry too. I don't know if we ever had a chance to.
Oh yeah, we didn't talk about Voice.
The end of it. We recorded the intro while we were there and that was fun. But you know what? I'll tell you what. One of the things I really liked about Voices of Dentistry this year is the diversity in the types of dental podcasts that are coming out. So there is still a lot of interviews. There's a lot of chit chat sessions, but there's a lot more niche within the niche within the niche ones coming out. And Michelle, you and I were on a bunch of the other shows. And so that was also unique and interesting for us because we've never really done that before. We always have people on our show, but we don't really go on their show.
We really don't.
At least not as a partnership.
No. You and I we're really good at what we do and we know, which are very separate.
Right.
I mean, we've joked before on this podcast, you and I don't know how us working in an office I don't know how that would look.
Yeah. I don't know. It wouldn't.
It wouldn't. We're very different clinicians. We're interested in very different things. And so the fact that we can go on another dental podcast and speak together, it's so weird. But we did good.
It was fun. We did above average, I think.
Above average.
And then Michelle did a cartwheel.
I did.
To prove that she could do it.
Well, I was challenged and I accepted that challenge despite your hesitation.
Fully supported. Nope. I knew.
You're so full of it.
I fully supported the fact that I knew that you could physically do that, but I was just not sure that was the right time or the place to prove your physical prowess.
Well, I will say I was very concerned because that's the first time I did a cartwheel since my surgery. So I was happy. I was very happy.
And you nailed it.
Thank you.
And you liked the outcome when you watched the video. Like, hey, I did a pretty good cartwheel.
I didn't suck as much as
I'm like, yeah, nice.
accepted the challenge. I was like, oh, crap, you want me to do this here, like in front of you? Okay.
Yeah.
That was fun.
And we saw a bunch of our friends there, and we met some new podcaster friends like Rhonda.
Yeah.
Right. We met Rhonda
from dental assistants, dental assistant rockstars. If I could say that correctly. TA Rockstars.
Right.
Thank you.
So she is so
what?
She's genuine,
energetic, amazing human.
Oh, loved her.
Mm-hmm.
Yeah. And we saw our buddy Michael Arias.
Yep.
And so he always does great. He does the marketing podcast. We saw, of course, the staples, Alan and Jason from Dental Hacks. We
Mark
saw
Costas,
who you were actually on his show, which was really nice.
Yeah, because I don't talk about business ever.
Yeah, so we saw everyone. It was fantastic, and we actually went through some of the CE courses this time, which I don't know if we did that before. So that was unique and interesting.
I really enjoyed the SF Dental Nerd.
Yes, Brian. I think we're going to try and get him on the show. If anyone wants him to be on the show, will you guys let us know what you want us to ask him? I actually had the opportunity.
He's the Instagram handle, SF Dental Nerd. If you're not following him, he's great. You should definitely do that.
You should. And I'll probably say this if we ever get a chance to interview him, but I think it's worth saying now too, in case we don't. Sometimes with these, quote, influencers, there's not a lot of substance.
They're full of hot air.
And yeah, that's a nice way of putting it. I don't buy into the concept of influencers in general because it's so much of like self-promotion. And I'm okay with self-promotion as long as it's going towards a good cause. But the problem I have is if you are doing the influencing to then get people to buy your course, I'm less okay with that.
Right. Yeah.
Anyway, so Brian, during his discussion, his talk or whatever, he did a really good job of explaining things. But then he and I were on the same plane going back to San Francisco. And so we both showed up to the airport early and we were just hanging out. And I'm like, yeah, so let's talk a little bit about some of the things that, that are hygiene related. And he knew so much about the new AAP classifications. Why would he know that? Why would he care about that? Why would he be implementing that into his office? Like, what is the upside?
Well, let's hope, because that's a mandatory in 2020.
Okay, look.
But I know what you're saying. Like a lot of dentists.
There's a lot of mandatory things that are not being done. Sterilizing slow speed, like that kind of stuff. So it's like.
Or like your water line testing.
And so, and I think he's more of a fee for service provider. And so, what is the upside to be doing it? I have a hard time from a business model standpoint in doing things with excellence. He and I both do he's a dentist, but I do restorative. And so we talked about kind of some of the bonding agents that he uses. He talks about using rubber dams. And we talked a little bit about that and about the perfection part of it. And it's not perfection of the looks. It's the integrity. And I think that really speaks a lot.
That's the thing. He has integrity, and that's the key.
Right. And so if you guys love just silly, funny stuff, he does a lot of that too. But I do want to kind of just say he's like a legit person to look up to. Yeah. So.
And he's got a cute dog.
Sure. That's why.
Yeah.
Okay. Way to take away all the good things that I just built up about how he's smart.
No, he's great. And he also has a really cute dog.
Anyway. So we have a good show coming up, everybody.
So we hope you're already enjoying this month of just how do we integrate medical and dental. And we really love what these two hygienists, Laurie and Michelle, are doing in public health, but they're going into OBGYNs, they're going into pediatric offices, and they are working in tandem with these medical providers. And it's really great. And I know you guys are really going to enjoy what these two amazing RDHs are doing in Arizona. And so we hope you enjoyed this episode with Laurie and Michelle.
Hey, Michelle.
Yeah.
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine.
So listeners, now that we are learning a little bit about what we can be doing this month outside of typical traditional private practice, I have two amazing guests that are doing just that outside of private practice. Welcome another Michelle and Laurie to the podcast. Who wants to go first and tell us all about you?
I'll go first. I'm Laurie Clark, and I am a hygienist here in Arizona. Went to school in Montana, and when I got done with school, I started private practice, and it wasn't exactly what I thought it would be. And I was a little bit disappointed, so I had to really step back and think about what I really liked about what I was doing. And I found out that I loved working with children. So from there, I transitioned into pedo. And I worked in a private practice, and I was actually the supervisor of the back office, which was a very large practice. So I did hiring, performance reviews, training, budgets, marketing, everything. And I did that for about 13 years and kind of got burnt out a little bit and thought, what else is there? So I went into the Arizona Dental Hygiene's sealant program to the Arizona Department of Health Services. And I worked on children's 2nd and 6th grade in low-income schools and placed sealants. And I worked on a lot of portable equipment, and we would set up anywhere that would have us, whether it be the cafeteria, a closet, a classroom. We just set up wherever we could. And that's what really gave me the love for community health, although I'd always loved it in dental hygiene school too. But I really enjoyed that. Through that, I was able to come to work for a hospital system called Dignity Health. They were sponsoring a grant through First Things First, and we'll get into that in a few minutes. And that's what got me to the position I'm at today. And I feel like I have really found my match. This is the best place I could be.
That's amazing. Well, welcome, Laurie. Michelle, how about you?
Well, interesting story. Laurie actually a long time ago was my mentor, and she taught me how to work in non-traditional settings. When I was in dental hygiene school in our senior year, we went out and did a field trip with our instructor to watch a dental hygienist providing services in an elementary school with portable dental equipment. It was the county's dental sealant program. And when I saw the dental hygienist providing these services, she had just graduated the year before me, this particular hygienist, and I saw what she was doing, and I said, if she can do that, I can do that. So then I that's kind of where I got my heart set on public health dentistry. But I've been a registered dental hygienist since 2000. And when I did, my first few years were in private practice. And I think it was about the 2nd or 3rd year in private practice when I reached out to the Maricopa County Dental Sealant Program, where I met Laurie. And Laurie's the one who taught me how to use the portable dental equipment in elementary school settings. Like she said, a lot of different places where we'd set up the equipment to provide services to underserved children. So then I took it upon myself to say, if I really want to be in public health, I probably need to get further education. Went back to school and did my master's degree in business administration. And then also it had an emphasis in health promotion, so the public health side, and then a doctorate degree in health sciences with an emphasis in global health. I felt like I needed to prepare myself for other opportunities. I saw the profession growing and merging with the medical field. So I said, we probably eventually are going to be seeing some medical dental integration, and I want to be prepared for those doors that open. I'm currently the manager of Community Oral Health Department at Dignity Health, Chandler Regional Medical Center, and I lead 3 programs here, and all of them focus on increasing access to oral health care among underserved populations. Before this, I worked for United Healthcare Community Plan as a clinical practice consultant, kind of doing somewhat similar work, but it was more on the health plan side, where we worked to increase utilization of the oral health services throughout the state. And that focus was also on the medical dental integration and development of workforce. So yeah, I've been blessed with a great career. Dentistry has been great to me. And I owe a lot of that to the people I met along the way, such as Laurie, and a lot of the relationships that were built when I worked, joined membership with the American Dental Hygiene Association. Being active in the association has also given me some of those connections to great people like Laurie.
That's nice. Laurie, you did say when you were in private practice, you felt like it just wasn't for you. And I'm curious, like, what that feeling was, like, what drew you to public health that kind of filled that void that private practice wasn't? Because I feel like a lot of people might have that same feeling and they just haven't identified it.
When I first moved here from Montana to Arizona, there were not a lot of jobs. So you had to take what you could find. And you always do that as a new grad anyway. And I just didn't feel like I was in the place that I should be. And I don't think I was that thrilled. And I'm sorry, everybody out there. I wasn't that thrilled with perio. And I really had to do some soul searching. I always felt like serving others was just my calling. And I felt that with children, I was doing more of what I was meant to be. And through working at the large pediatric practice, I was able to expand and not just provide dental hygiene services, but I was able to expand into marketing, preparing budgets, preparing schedules. And I was there for 13 years, and it was a fantastic place to learn. We had consultants and training, and it was just a nurturing place for me to be, to set my foundation for dental hygiene. And we did a lot of volunteering in that office. If anybody in the community, such as the schools, found a child that needed help, they were the first ones to say, hey, send them right on in. And I think that's what sparked it, is that ability to help others that really needed it and that were disenfranchised.
So you may bring this up in your program description, but Michelle, you mentioned how medical and dental are starting to become integrated a little bit more. Can you speak to that, or is that just what your program is doing, or are you seeing that more in Arizona specifically?
I guess I've seen it more in the work that I've done with health plans and with hospital systems. Even when we approach like pediatric medical offices or OBGYN offices to say, hey, can we send some dental hygienists here to provide services at your office for your patients during their medical visit? There's not as much resistance or hesitation as there was 10 years ago when I would talk to medical professions about this. So when you say, is it more local? Is it the state, or is it more global? So I'll answer on each layer. I think I definitely notice it more locally, that the doors are much more open. The medical professionals are much more open to the concept or the idea of some type of collaboration. And then I would say I also notice it throughout our state. As I worked with United Healthcare to build some models throughout the state, I heard more yeses than nos, which would have been different, I think, 10 years ago. But then also that work with United Healthcare, I had the opportunity to talk with other Medicaid plans throughout the U.S. And the work that we were doing in Arizona, we may be advanced and kind of trailblazers in this space. But what I found was the other states were very much interested and would reach out to us a lot to ask, what are you doing? How are you doing? We want to do it. So they weren't necessarily my target population, but they would hear about what we were doing, and they were much more open to receiving it and considering a model in their state too. So I think, to answer the question, I notice it locally. I notice it throughout our state, definitely. And then I do notice the other states having interest in it.
That's nice to hear. So let's talk about your programs and what you're doing as dental hygienist right now.
Okay, I'll start with a program description, probably a good foundation to lay to begin with. We have a program called First Teeth First, and it is funded by an organization called First Things First. And First Things First is an organization at the state level for Arizona. And that organization is funded by tobacco tax. So the state collects tobacco tax, it goes into an account, and then First Things First utilizes this funding, this tobacco tax funding, to focus on early childhood development. So one of their components is childhood readiness for school and brain development, like teaching the parents good parenting skills, and also teaching the parents about childhood development, teaching the parents how to read to the children, kind of good habits for the children. Also, they focus a bit on medical care for the kids, and they have a category that they focus on within health, childhood health, and it is dental. So we are one of the programs that are funded by that funding from First Things First at our state level. The services that we provide in our program is oral screenings, fluoride varnish, anticipatory guidance, also some goal setting for the parents to implement different oral health care preventive measures in the home. And also a big portion of our program is care coordination. We help the families coordinate and get plugged into a dental home. So by age 1 is the goal, of course. And our patient population is age 0 to 5. And also expectant mothers. So the locations that we set up at and that we collaborate with are WIC centers, the Women, Infant, Children centers, pediatric medical offices, and OBGYN medical offices also. And we feel like those locations, we can find the expectant mothers and the young children, age 0 to 5. And our program previously used to go to daycares much more frequently and schools and health fairs and such. But we felt like at the schools, we're not always able to capture the parent, right? We might get the child with the signed permission slip form, but as we target more medical dental integration models at pediatric, OBGYN, and WIC centers, what we're noticing is we can get mom and child together. So it's a better experience. I think it's a deeper experience, especially for the parent. We can work through some goal setting, share with them anticipatory guidance, and then, of course, do that care coordination piece. We also offer professional trainings for general dentists and pediatricians and obstetricians. Some of the topics that we cover is oral systemic link. We also cover oral health care for the young child. And I know that there's a lot of general dentists that sometimes don't feel comfortable seeing a child between the ages of 0 to 5, the young ones. So we provide for them some tools and tips and things that they can consider or expect when providing services for age 0 to 5 and just encouraging them to do that. There are no charges for the services that we provide. So the patients do not pay for the service, and the practices that we partner with, like the WIC centers, the pediatric offices, and OBGYN offices, do not pay a fee for the services that we provide. So we're fully grant funded, which can be good and can be bad, right? It's not necessarily a long-term sustainable plan, but our state is very supportive of the utilizing tobacco tax for the First Things First program. So we feel confident. We've been around for, I believe this is our 10th year.
Wow.
So yeah. One of the unique things that we do in our program is that we utilize a promatora. So the promatora is, we have a high population of Spanish-speaking members in our community. So our promatora is like a lay Hispanic or Latino community member who receives some specialized training from us to provide basic health education and guidance to accessing resources. A lot of our families need additional wraparound resources, whether it's transportation assistance, housing assistance, those kinds of things, food assistance. So we have our promatoras help assist with not only coordinating that dental home, but also taking a look at what else can we help the family with. So they're kind of a liaison, I guess you'd say, between our provider, our dental hygienist, and the patient. Their role is really to kind of advocate for the parent and the family and be an educator for them, be a mentor, kind of an outreach worker. Yeah, and they also do a lot of interpreting, right? So they know the language, so that helps us tremendously.
I'm just curious, how do you monitor success within your program? Is it like the pregnant women at the OBGYN coming back and performing good oral care for their newborns or, 1-year-olds, whatever? I mean, is that, or do you get to see them on a routine recall basis at all?
So no, it's not something where we see them regularly. Sometimes we will because they come back for their follow-up appointment or something like that, which is really great because then we can build some relationships with them and help them with additional resources. But in general, the way that we measure success in our program is, I always say to the team, numbers are great. Service units are great. We want to reach as many people as possible. That's good. Okay. Fluoride varnish is good because we put fluoride varnish on, we provide fluoride varnish. So, okay. So that's good. But great is care coordination. Like they got a dental home. We plugged them in to a dental home. So then we know they have a place to go to for more than just the screening or more than just the fluoride varnish. they have a long-term dental home to get their preventive services, their restorative services. So that's really how we measure success. We've implemented a lot of new measures, taking a look at how are we doing. The care coordination piece is relatively new for us. The last year and a half, we've been doing the care coordination. And so we've implemented a few measures to see how we're doing with that. And we'll be taking a look at those quarterly, kind of taking a look at how successful have we been at plugging folks in? Are they actually going to their appointments? That kind of thing. So
yeah.
Wow, that's really great. And I love that it's Andrew and I are very different. He loves the numbers. And I'm like, but did they get that dental home? So that's great.
Right?
I love that. So let's talk a little bit about the history of your program. I love the name, First Teeth First.
Oh, I know. Isn't that cute?
It is.
So we started in 2009. The Dignity Health program started in 2009. At first, it was child cares and preschools, Head Starts. But when we found out the numbers in our state weren't adding up, we had more kids arriving at kindergarten that had gone to a dentist, but the decay experience was not going down significantly. We had to change the mode that we were working with. And we didn't have the parents present. So I think that was a big change for us, was to switch our partners and move into places where we could have that one-on-one with the families, especially the parents. And in 2018, the grant changed and wanted us to change partners. So that's the starting point of our medical dental integration endeavor. So what we did is, Michelle had mentioned that we did lunch and learns for pediatric practices. And we had a pediatric practice that was really fit the demographics that we were looking for. And we had done lunch and learns for 3 of their different offices in the East Valley of Phoenix. Their name is Happy Kids Pediatrics, and they're really forward thinking. So Michelle was able to meet with some of the top administration, the executives of their practice, and come up with a way for us to come in. And to me, it's a no-brainer. We come in, we're free, we bring our supplies, we do all of the anticipatory guidance, answer their questions, provide wraparound services, and hook them up with a dental appointment. To me, it's just a no-brainer. And I guess they thought so too, because we started at one practice, expanded into another location. Now we're in 3, and we're hoping to go to the 4th that they're building and should be done in March. So that's how we started with this. And to get started in the office, after the agreements were drawn up and we realized that, this could really work well for both parties, we came in and did a lunch and learn for the staff, provided food, of course, and provided CE, and talked about the baby, the infant, the toddler, young children's teeth, and pregnant women, and how important that was. And that was really successful to buy into creating some relationships with the staff. So then we show up as a team, 1 hygienist, 1 promatora. We bring our supplies with us. And as the physician exits the exam room, we go in with our supplies and provide all of those things. It usually doesn't take us more than 5 to 10 minutes. We have developed some excellent relationships with the staff now, and it's been nice to collaborate with the providers as well. There are things like thrush infections, things like that we collaborate on, and it's been a great learning experience.
I'd like to add a little bit to the history, if that's
Yeah,
okay.
please.
As Laurie mentioned, the program started in 2009, and it used to be focused much more on schools and daycares, where we would get the permission slips from the children, signed by the parents, and they'd bring them back in the backpack. But the rules of the grant that we received changed in 2019, and it was based off of the prior year's results from the grant. So they compiled all the work that had been done since 2009 throughout the state of Arizona with First Things First, and all the dental programs that they had throughout the states. And they found that dental visits went up. So First Things First determined that, what we're doing is working throughout the state. Decay experience, however, they noticed was not coming down in kindergartners, and parents were not aware of dental coverage oftentimes, like if they have Medicaid or Access. We call it Access in Arizona. Our Medicaid system is called Access. So I guess they felt like, there's more work to be done, and how can we bridge that gap? Maybe what we need to do is bring the parent into this experience. So that's when the rules of the grant changed. And the rules of the grant then started requiring the care coordination piece. I guess we could have still kept going to daycares and schools, but some of the experience I had had coming from United Healthcare kind of taught me otherwise. And I thought, no, I think we need to capture them where mom and child are together. Laurie, did you want to say anything more on that, about the Healthy Bodies report or anything like that?
Well, our information every 5 years, our state does, our Arizona Department of Health Services does a Healthy Body, Healthy Teeth report. And it's on kindergartners and third graders. And when that report came out, that's what really shifted the thoughts that, hey, we need to be where the parents are so we can provide that education to the whole family. I'd always kind of known that because we had done health fairs, here and there. And when you can get the family together and get the parents involved, I think it makes a significant difference.
It was a big turning point, I think.
Yeah,
for the program and for us. Yeah.
And then the care coordination piece too is huge. And that's where we can call back and make sure that they're hooked up, they got plugged in, or if they had trouble finding a dental home, or maybe the situation has changed in their home and they have no insurance and they don't know where to go. So we will be able to provide the information through the care coordination services.
When you first went into the pediatric offices or the medical offices, was there anything that was surprising to you that they didn't understand about oral health, or that they were like, wow, I'm so glad I know this now? I always think it's really interesting how segregated we are and what little we know about what the other, medical does, dental does. So was there anything specific where they were like, oh my gosh, I didn't know you guys did that, or I didn't know oral health caused X, Y, and Z? Anything like that?
Well, I would like to say I was pleasantly surprised at how educated and how on board the pediatricians and nurses were.
That's great.
It blew me away. They were all for it. They knew what they were doing. Many of them are performing screenings. And the thing that they are frustrated with, and I've heard this numerous times because we have presented to many pediatric offices, is they do the referral at age 1. And then the general dentist, the family goes to the general dentist and says, oh, we don't see him till age 3. So there's a big disconnect out there. I think the newer dentists are coming around, but from a pediatrician standpoint, that's the big disconnect. And the staff is totally on board, and so are the pediatricians. I've just been really pleased with the enthusiasm.
That's so great to hear.
I think one of the things that contributes to the enthusiasm from the pediatric offices is that when we go to even the American Academy of Pediatrics website, they've got a ton of stuff on dental. It's amazing how much the pediatrics arena has really published, researched, and promoted oral health for children. And as I mentioned earlier, 10 years ago, this was a difficult conversation to have with the medical provider, but it's much easier now. And I think because each of these professions that we feel a little siloed from are starting to gain an interest in oral health. I even see it in nursing. Nursing is taking more of an interest in oral health. Also, they get very little training in oral health when they're in school, is my understanding. But once they're out in the field now, we hear so much more discussion about it. And I think they're really understanding. And again, that's because the Nursing Association has done publications and education and outreach to their membership base of the nurses to educate them a little bit more. So I think there is, much more enthusiasm around the topic because they're hearing and learning more about it. The partners that we have that Laurie mentioned that are very enthusiastic is Happy Kids Pediatrics. Also, we partner with Pendleton Pediatrics, and the OBGYN office that we're partnering with is Mom Docs. And one of the things that I learned is that it can be, and anyone in any state can do this. This applies nationally because the Medicaid standards are set by CMS at the national level. So the model can really be a win-win-win, right? So it's a win for the patient because they get their some oral care services while they're there for their medical appointment. It's a win for the medical office that we're at, and I'll explain why in a moment regarding the Medicaid measures. And then it's really a win in general to the healthcare system because we're reducing costs with promoting that preventive care. So the thing that I learned was there's a measure called annual dental visit. And in the health plan world, we use an acronym, ADV. So that annual dental visit, that ADV measure is something that the health plans are held accountable to. And what I mean by that is, let's say I'm a medical provider. Let's say I'm a pediatrician and I work at ABC Pediatrics or something like that. The health plans that I'm contracted with come to me and say, hey, we'd like for you to see the members on our health insurance panel. And of the patients that you see within our health plan, if you have 60% of those patients have a dental visit, then we will share with you the cost savings. So we know there's savings with preventive care, and the health plan can benefit from their members getting preventive care. So they're partnering with medical and dental offices now and entering into what we call the value-based contracts. So if a medical provider is held accountable for their patient base getting a dental visit, that can be a little frustrating as a medical provider, right? They're a medical provider. They say, wait a minute, like, how can I affect this? Or how can I impact this measure? I'm not a dentist. How can I impact this measure? So then we enter, right, as dental professionals, dental hygienists, and we say, hey, I can help you with that ADV rate, with that annual dental visit rate. I can help you hit the mark that you need for the percentage that you're working on with your health plan. And we can hit those measures. So what's in it for the medical office if they hit that mark or whatever goal that's determined between the medical office and the health plan in that value-based contract? I use the example of 60%. So if 60% of the patient caseload has a dental visit, what's in it for the pediatric office or medical office? And we know what's in it for the health plan is cost savings, right? Well, what's in it for the medical office is the health plan then says, we will share with you in that savings. So the health plan, the medical office gets a bonus check essentially. So there's a little carrot, right, that's being dangled. And I've waited for so long being in public health. I'm just so excited that finally we're seeing a day where preventive care is being incentivized. Before it used to be we would incentivize or pay a higher rate for surgical procedures or restorative procedures, right? Or prescriptions, So the concept is changing even within the hospitals and the healthcare system that Laurie and I work for here at Dignity Health. We're even noticing it on the medical side and with the hospitals. The surgical cases used to be more highly rewarded financially, right? And incentivized. And we're seeing that change pretty drastically to now there's more incentive to help patients prevent disease or control disease. And it's all based on these value-based contracts. Dentistry is a little bit slower to the table. I think maybe we're hesitant because change is hard in general, but also we're kind of seeing how is this going to pan out for the medical world, right? So Arizona is piloting a few value-based contracts with dental offices. So I think that we'll eventually start to see that. But anyhow, my point is, I think that anyone in any state, to all your listeners, anyone in any state can utilize this tool that's already in place, this value-based contract, and approach a pediatric office or OBGYN. The OBGYNs in Arizona do not have a dental measure in their contract, but in general, you can approach them and say, hey, I can help you with that value, with that measure, that annual dental visit measure. And I think that also builds a bit of enthusiasm, right? From the medical practice. Yeah.
No, that's great. I love hearing that. That's something that we can do in any state.
Yes. It's a win-win-win.
It is.
Let's talk about the care delivery. Laurie, I think it's so important to share with the clinical dental hygienist kind of the details of what you do. Do you want to run down those bullet points under care delivery?
Yeah, I sure do.
That'd be great.
Okay.
So as a hygienist, when I get to the facility in the morning, there are a team of 2 of us, a promatora and myself, and I pack all the supplies. So we have to have everything, sealed and clean, and so that we aren't cross-contaminating. So we have to really be cautious of that because we transport all of our supplies and equipment with us, whether it be laptops, cell phones, and then all of the dental equipment. So everything has to be packaged carefully. And so when we arrive, we kind of set up and we coordinate with the medical assistants as to what rooms we're going to go into. And remember, it's 0 through 5. So we're not seeing all of the clientele that's coming into the pediatrician's office because our grant has specified the 0 to 5. So we work together with the medical assistants to find out if in the exam rooms we have a patient that's of age, and do they speak Spanish or do they speak English? Because then we kind of share the duties between my coworker, the promatora, and myself, who will enter the room and explain what we're there for and what we're there to do. And I found that what works best is what I was taught in dental hygiene school with children is not to ask, but to tell what I do. And here is the consent form. So I give out the consent form and they get to fill that out while they're waiting for the pediatrician to enter the operatory. The provider will go in, the medical provider will go in, and they'll do all of the things that they need to do. And then we usually come in, if they're going to be giving vaccinations, they let us usually go in before that. And we're thankful for that because we don't want to be trying to look at a child's teeth when they're all upset after having a shot. So we go in, we review the consent form, visit with the parent, build up some rapport, find out what really they're interested in finding out and learning. We use a lot of motivational interviewing in the time that we are with the parent. And so take a look inside, do the screening, apply fluoride if we need to, do the anticipatory guidance, and we will set an appointment. And when we're finished, we always ask the parent what they would like to work on with their family for an oral health goal. And sometimes they don't understand what that is. So we kind of review some of the information we may have covered, like, would you like to maybe start brushing twice a day rather than once a day? Would you like to try to keep up with your 6-month recalls? Do you want to start drinking more tap water with fluoride in it? So we kind of just review the high points of what we went over. And at no time do I ever push it. I let them decide. I just kind of give them some information, review some of the information we covered and let them come to the conclusion. So it's really exciting because the parent walks away with a dental appointment for their child, information and a goal for what their family is going to work on. We always cover the appointment etiquette because maybe some people don't know that they're supposed to arrive 15 minutes early or have the teeth really clean before they get there. So we cover important things such as appointment etiquette. Then they go with a goodie bag and with the oral aids in it. And it's rewarding. The parents are happy and the medical providers are happy that we have the time to spend with them to get them plugged into a dental home.
Now, are you working with a dentist or just how does that work?
Good questions. So we have a dentist. Now remember, we're part of a hospital system, but our model still needs to work within our state laws for dentistry, right? So we do have a dentist that signs what we call standing orders to permit the screenings and fluoride varnish out in the field. So every state's going to have a little bit of a different requirement around what their public health dental hygienists are allowed to do. We have different layers of public health hygienists in Arizona. We have the affiliated practice dental hygienists, and then we have the general dental public health hygienist. So I would encourage everyone to kind of take a look at what is their state law, what's in their state statutes, what's in their dental practice act. regarding the ability to work without a dentist present, right? With the ability to see a patient prior to a dentist exam by dentist. So for us, we do have a dentist we communicate with mostly through teledentistry, and we see in person for quarterly meetings also. We have a fair amount of communication through phone, through email, and such. And so there is that involvement, but for the cases and the type of work that we're doing, we don't necessarily need a dentist on site to assist with screenings, fluoride varnish, and care coordination. If there is something that comes up, that dentist is available for consultation, and that's part of the agreement and the Dental Practice Act. So yes, we do have that as a resource.
Okay.
Michelle, most of the time when we're working with these, we're using the basic screening tool, and it is so basic that, remember, any medical professional can pick it up and use it. So we're not being very specific. And we also communicate that we are not a dentist. We're a hygienist. We're here to educate and get you to the next level that's going to help you with these more complicated issues for your oral health. So we make it really clear that we're the liaison to the dental office as well.
Yeah. And I think that's something that sometimes I know I struggled with it when I came out of private practice. We're so used to being very detail orientated. There's cavitation on the distal lingual of number 3, right? So in public health, it's not like that at all. You just say, you kind of categorize them. It's kind of like triaging, right? You say, is there any immediate needs that need to be addressed within the next 24 to 48 hours? Is there urgent? Is it pain? Is it, that kind of thing? Or is there maybe the middle category would be, is there some fillings that need to be done or some decay that needs to be addressed within the next 2 weeks? And then, or is it simply that they just need to remain on their 6-month recall? So we're triaging. It's not quite as detail orientated. I think I'd like the opportunity to discuss steps to implementation. If any of your listeners are interested in setting okay.
Yeah.
If you're interested in setting up a model that's similar in medical dental integration as ours, a few key things I think to share is that partnership building is so important and it takes a lot of time. And sometimes you will hear a lot of no's before you hear yes. I've had to develop a thick skin to several doors closing or hearing a lot of no's. But what I have found is that persistence pays off. Sometimes I say to folks, well, I'm not going away, so maybe you should just say yes. So the model is good for some and not good for others. Like we've noticed breaking into the arena of OBGYNs is much more challenging than breaking into the arena of pediatrics. Yeah, for some reason, the pediatrics just have a different heart, a different focus, the OBGYN, and we find is a little bit more regimented. They're very, very tight on their schedule. Not to say that the pediatrics doesn't have a schedule. At the end of the day, we know that business, the lights need to stay on and business needs to earn money, right? To pay the bills. But OBGYN seems to be a little bit more hyper-focused, at least in our experience. Talking with several OBGYN offices, a little bit more hyper-focused on the production and the numbers and how will our program disrupt their workflow and, potentially reduce their revenue stream. So we offer to them, and part of the proposal is we can set up the model in one of 2 different ways. Either the hygienist follows behind the medical provider in and out of the exam room with a small kit of supplies, or after the medical provider is done seeing the patient, they can send the patient to a designated room where the dental hygienist and promatora are. So whichever way works best in their workflow so that we understand we're a guest in their home and we don't want to disrupt their schedule or put them behind on their production. So it's just a matter of navigating in those waters and offering those different office options. But the first thing I do is an in-person visit in the office. Obviously, there's a lot of exchange for emails, just building that relationship. And then we do some conference calls where we get their team on board and our team on board. And then, of course, bring the 2 teams together in in-person meetings. Also, we have our hygienists provide for the office a continuing education class talking about the program, but also other things about dental, like how to take care of a child's oral health or even oral systemic link kind of stuff. something that would appeal to that office at the same time as introducing us to them. And then we discuss with them, with their whole team. After we're pretty firm on the relationship, we'll bring the team back to talk about, it's kind of a general meet and greet and educate them about the workflow and discuss the program to a deeper level about details of workflow. And then there is proposals and facility use agreements. The proposal just describes who, what, when, where, basically, what is the obligation of the office we're going to be working with, and what is our obligation, what do we commit to. Basically, we usually ask the office the medical office to provide us a clean, safe space. And what we commit to is pretty much everything else. We'll bring our supplies, we'll bring our own staff, that kind of thing. Facility use agreements just allows us to legally be there and make sure that the office has the right type of general liability insurance that needs to be in place. And then we begin services. After we begin services, I follow up with a call twice a week for about 3 weeks. And I talk with the leadership of the medical office just to check in. Hey, what's working well? What's not working well? Are we being good guests in your house? Kind of a thing. So, Laurie, do you have anything to add to that? But I just want to make sure we shared kind of things that we've noticed as good steps to implementation.
No, I think you did a great job.
So what are some of the challenges that you've experienced with this program?
For me, one of the biggest challenges has been finding care for the parents. It's not required in our grant, but you get asked that question. And here in Arizona, we have quite a few options for children, even the uninsured children. We can pretty much get them seen and find them some type of care out there. But when the parents tell us that I've got toothaches or I've got this abscess, we don't have a lot of options out here. And so that has been really frustrating for me. That's, I think, been one of the biggest challenges that I've encountered. Now, we are working on this at the state level. The Dental Hygiene Association and the Dental Association, we're working with the legislature to try to get some funding through our Medicaid program to help the pregnant woman obtain some services. But as far as the adult for services here in Arizona, it's very, very slim.
Do you find that when you're, outside of them being in pain, when you're doing the oral care instructions, the motivational interviewing for the child's oral health, do you find that they are also like, oh, I didn't know I should be doing that, or could I be doing that too? Like, did the adults learn as well?
Absolutely. And the way we teach is for a family. We teach for the child primarily, but we are always thinking about the whole family. And what I'm really proud of our program is that we don't just focus on oral health, but we will look at, there may be comments that come up. Maybe there's food insecurity, or maybe a grandmother is with them that has no medical insurance. So we focus on other ways to provide resources for that family. So we look at the family unit to be very healthy, not just the individual child.
Other challenges that I see from an administrative perspective as a manager of the program is just some of the field coordination, obviously scheduling, budget, those kinds of things are my everyday trenches. But I think it can be challenging sometimes to get, even after you're at an office, you're partnered and collaborating with the medical office. I think it sometimes can be challenging to get everyone in the medical office on board. Sometimes you'll have that one medical assistant or that one physician that just maybe doesn't understand or value the services. And that can really, really reduce the number of patients that we see in a day. And of course, I'm looking at it from a perspective of we are held accountable to the grant standards, right? And the grant is that the grant contract that we signed is that we agreed to provide so many services of service units, which means, so many children that we'll see or so many expectant moms that we'll see and provide services for. So, I'm looking at, we need to make sure that we have a consistent flow of patients. And if you have, 1 day a week or even 2 days a week where you're at an office that has one person that just isn't sold or bought in, and it can be challenging and really, really affect the numbers and service units that we're able to provide. So, usually what I do in those cases when I start to notice numbers slip at a certain location is the supervisor and I will go out, make a visit. We'll sit and we'll chat and we'll just say, hey, what's working for you? What's not working for you? How can we assist further? Sometimes it's just relationship building. sometimes there's other barriers that we didn't realize or didn't know. So again, it's just always keeping that communication. You put in a lot of effort into that relationship building and continuing that relationship. So from
that
administrative perspective,
I'm just like, who would not want this? But I guess if it's getting in their way and it's there's other barriers that, or maybe they don't fully understand the program.
Yeah, it's
That's
one
what
more
I
thing
feel
for
too.
them. Yeah, it's one more thing for them to do in a day, and they already have so much on their list of things.
What's the future of this program? Do you know? Is it going to evolve even more?
Yeah, I'd be glad to discuss a little bit about our next steps for the program. For me, if you ask me personally, hey, where would you want to take the program? I have a tendency to have like big dreams and of this vision that, I would love to see this program integrated more deeply with other programs at the hospital. I feel like we're sitting in a very prime location, being partnered with a healthcare system. So I would love to see it. And I've integrated more deeply. And I've had these discussions frequently with my director about potential opportunities to integrate with the Phoenix Children's Hospital, where Dignity Health is in collaboration with Phoenix Children's Hospital, and we're actually building a Phoenix Children's Hospital tower on one of our campuses. So I see that a lot of potential there because there will be a women and children's care center there. So I also see a lot of potential for integrating into some of the hospital programs, such as our transitional care program, where a patient that maybe had a stay at the hospital is discharged and is on their way home. And as they're on their way home, the nurses do an assessment of what other resources might they need. So they have a general idea that maybe this patient needs assistance with medication, securing their medication or securing healthy food. And so we do a follow-up visit. The hospital will send, depending on that patient's severity of needs, they will send a patient, a worker out there. Usually it's a nurse practitioner and sometimes a social worker out to the home of the patient. And then they do an assessment of the area, basically of the home. What are the conditions like? Does this patient have transportation to their next medical appointment? Do they have the prescriptions that they need? What is their living quarters like? Is there rugs that maybe would be a hazard to a slip, trip, or fall? Do they need, maybe they have instability or balance issues. Maybe they need some bars mounted in their bathroom for safe shower taking. So these kinds of things, they do an assessment of the home and such, and kind of take a look at what are the other wraparound services that they might need. I would love to see our dental hygienists integrated with that type of program where they're going out to the home and doing some home visits also with this kind of a team. I also think there's a great opportunity for integration within the oncology department. I noticed that a lot of our patients here at the hospital that have oncology treatments, whether it's chemo or radiation, struggle a lot with discomfort in the oral cavity, yeast infections, obviously thrush, things like that, candidiasis. We have so many great products in dentistry to use and so much great oral health preventive education to provide them that the nurses just aren't aware of. And also, as I mentioned earlier, they have so much that they're doing that is just one more thing on their plate. So I could see a great integration there. And the last area that I would love to see some integration is within the ICU, the intensive care unit. And we have started that here at our Chandler Regional Medical Center. As I mentioned earlier, a manager for 3 oral health programs here at Dignity Health. And one of the 3 programs is relatively new within the last 2 years. And that one is integrating dental hygienists into the intensive care unit to provide oral care for the patients that are intubated or have a tracheostomy. And what we're doing there is reducing the pneumonia rates. That's the goal there, the ventilator-associated pneumonia rates. So I do see how oral care and this program could be integrated, in a lot of other areas within the healthcare field.
Wow. That would be fantastic. And I love what you guys are doing. And thank you so much for sharing this information with us. I definitely was on the search for finding hygienists that are working in the medical field. That was what my goal was. And I feel like you guys have integrated it so beautifully.
Well, thank you. In closing, I'd love to say that Laurie and I are really enthusiastic to continue contributing to the advancement of the workforce models that integrate medical and dental care and also increase access to oral health care services at the same time. So we're open and available to helping others implement their medical dental integration strategy. And just know that we are available for mentorship, or we're glad to share any information about our model. We're pretty much an open book. So if anyone needs resources,
great.
we're glad to assist.
So if that's the case, how can they reach you? How can our listeners reach out? Or is it email the best?
Yes, mine is Laurie, Laurie .Clark, Clark, at dignityhealth.org.
And mine is Michelle, Michelle .Gross, Gross -- Panico, P as in Paul, A as in Apple, N as in Nancy, ICO, 2 at dignityhealth.org.
Awesome. Well, thank you guys for taking the time and giving such a thorough, description of what you guys are doing. And thanks for all your hard work as well.
Oh, we love our work.
We're blessed that way to enjoy what we're doing, right?
We really are blessed.
Yes, it's great. Any last things that you can think of, or any final thoughts for, let's say, a new grad or a student that is thinking about doing public health?
I think it's really important for them to work any volunteer projects that they can get into. I mean, that's what sparked my interest. And then also get involved in anything that you can get some public health experience. Like for Michelle and I, it was our Arizona Dental Hygiene, our dental sealant program that really got us going, learning how to use portable equipment, working with a different population than we were used to. And I would just encourage you to try to find those types of jobs so you can get some experience in it and really try it out, test it out, see if it's your thing. Make sure that you like it.
Great advice. All right. Well,
thank you so much for having us.
Yeah, no, this is fantastic. Thank you for your time today. And please, listeners, if you are interested, definitely reach out to them. They have an amazing program, as you just heard, and just, I'm sure, a wealth of knowledge in this area. So if you are thinking about integrating this into your state or local area, I think they'd be wonderful resources for you. So thank you, guys.
Thank you, Michelle.
Thanks. Bye-bye.
So one thing I loved about this interview is that Laurie was Michelle's mentor. And then now Michelle's out there like managing this big old public health like initiative. I love it. I love it. I love it. Because one of the things they said is like, this is something every state could do. And they hopefully piqued your interest so that you're like, yeah, I want to go see kids from 0 to 5 and talk to the parents and like get them started on the right regimen. Like, you can do it, guys. So all the people that are like, I can't bend over one more minute over a hygiene chair. My back's killing me. My hands are killing me. There are options for you. And that's why we had this podcast. So we could bring you the options.
Yep. Great work.
Yep.
Good job with the interviewing and stuff.
Oh, another one without you. Someone did ask why you weren't on the podcast as much.
And then
anymore.
you told them, like, I tried to fire him and he just clawed his way back into my life.
I didn't go into those things, but yes, I did try to fire Andrew because I was in a poor mental space.
Yeah. Oh, we're telling the truth now. Okay. I thought we were just joking around. I didn't know that we were really going there.
That was actually the truth, though. What do you mean?
No, I didn't know we were going to be that transparent and honest with our listeners. I thought we were going to lie to them a little bit about this.
I think we always are.
No, the honest truth is, for anyone that really cares about the answer to that, is, we started the Dental Podcast Network. And that has taken up so much of my time initially to get it going. But then the hosts really started just taking it and running with it and doing their own thing. And that allowed me then, and you've heard I've been on a few more episodes lately because I've had time to do all that. But now again, like, it's starting to kind of get crunch time. We have contracts and, on the business side of things that, again, not probably any of you care about, but on the back end, the business and the kind of the organizational things, that I'm running that too. And Michelle's really in charge of all the content and, marketing, branding, like all of the creative part of it. And then I do all like the business and the monies and the stats and the garbage. So we have a very good partnership going. We have a really, really strong business. It just, not everyone has all the time. Oh yeah. Plus we work full-time jobs and stuff, like we have other stuff. So other than that.
Yeah, I mean, and we've always been very, very transparent on this podcast. And I think everyone who's listened to it from the beginning or even started at the beginning and you made your way all the way up through 2:15. Is that what this is?
So many hours.
Well, and you know that we never started this to be a business.
Right.
Like never was the intention. It was always a hobby. It was always like, we'll see where this goes. And then it just kept growing and growing and growing to the point where we were like, our friends were like, get a website already, you weirdos. Like, we know this, and I think everyone else sees it too, that we're just very lucky that you and I met on Facebook and this works. Like, I don't, so in no world is that normal.
No, it's not. I mean, people meet in real life and 50% of the time get divorced. So like, come on.
I know.
So
right?
Yeah.
It's so true. Again, we are pretty transparent on this. So yeah, that's why you haven't really heard Andrew on a lot of it. And, because my job has changed and I have a very different role and I'm doing a lot of more things like independently, like as a speaker and a writer. And I kind of branched out a little bit at the end of last year. I now have a little bit more availability to have these podcasts on like random Thursday afternoons when Andrew's like 40 hours deep into patient care. And I'm like, I already saw my patients on Wednesday, so I'm good. I got nothing but time on Thursday.
Yeah.
So it just works out. Yeah.
Well, yeah. That's it, everyone. Sorry it's not as salacious and cool as you guys were hoping, but that's all we got. Just busy and
I know. People are, because we've even had people like ask, do you guys really get along? I'm like, well, it depends on the day.
Depends on who you ask.
Most of the time we do.
I think.
It depends on who you ask. Because some days I'm like, I could freaking kill him today.
And I'm like, just give me a hug, Michelle.
Barely woke up.
Give me a hug.
And I'm like, get away.
And I'm like, it's 7 a.m. on the East Coast.
Emotions.
Why are you waking me up? Yeah.
And I want to kick you in the face when you don't wake up on time. That's the behind the scenes, guys.
Yeah.
You're welcome. So coming up, we're going to be at Midwinter. I'll be at ICOI ADIA in Houston at the end of February. Then we'll be at Hinman. I'm really excited for all these upcoming meetings, especially at Hinman, because we are going to have a booth, a podcasting booth with the mommy dentist doing business or something like that. Sorry if I didn't get that full name right. And millennial dentist.
Yes.
Yeah. So I'm really excited. We're going to be there repping the hygienist.
And I don't know if I talked about this on the podcast yet, but the same time that you're in Hinman, I really wish I could be there. It's going to be a great thing.
Oh, yeah.
But I'm going to go to the Philippines and I'm
Try not to get the coronavirus.
I will do my best. I'm going to be trying to set up a dental mission trip for 2021. And so I just need to meet all the right people and find, the place and the things and all the logistics of it. And so hopefully I'll have some good stories after that. We also have a couple of other places that we're going to have a table. So Hinman's, it's the first one we're actually going to have a table at. I guess we had Voice of Dentistry, but I think we're going to try and go to the Washington Symposium for the Dental Hygiene Symposium this year. We're going to go to ADHA and RDH under one roof, and we're going to try and have a booth there too. So we're going to really do our best to make ourselves in one place so that we can meet you and maybe record something with us.
Yeah, that'd be fun. So I hope everyone had a really great week. You're enjoying this series. And don't forget, if you're on social media, we'd love for you to follow us on Instagram and Facebook. Definitely rate and review us. We appreciate those so very much. And if you are listening to this for the first time, hit that subscribe button or that add button or that favorite button, whatever that looks like in your little podcasting app. And you can always listen to us or leave us a message at taleoftwohygienists.com, where we actually have an online learning center with things like Chairside Chat, Science Sundays. You can find all of your CEs there, listen to all the episodes. It's even broken down into tipisodes, episodes, bonus episodes, mission trip episodes. We have all of that on our website, and we'd love for you to visit it. Well, we hope everybody has a great week.
All right. Bye, everyone.
Bye, y'all.